Welcome everyone. Thank you for joining us. I'm just going to give everyone a few more seconds here to trickle in before we get started. Thank you for joining us for today's webinar, From Policy to Plate, the Role of Child Nutrition Programs in Filling Nutrition Gaps and Promoting Whole Grain Intake. Before we get started, I just want to go over a couple of housekeeping notes. Yes, we are recording this session. The video recording will be posted on our website within 1 week. And that will be posted on oldwayspt.org/CPEU and also on the Whole Grains Council website, wholegrainscouncil.org. We would like to give a huge thank you to the sponsor of our session, the General Mills Bell Institute for Health and Nutrition. We're so glad to have this topic here for you today. We will have time at the end to do some question and answers. So if you think of any questions throughout this presentation, you can just type them in into the chat box or into the Q&A box, and we will save those for the very end. I see, yes, viewers are muted automatically. So the only way to get in touch with the panelists is through that chat and Q&A function. And this is eligible for 1 continuing education credit for registered dietitians. And you will receive an email with your CPEU certificate within 1 week. And everyone will receive an email within 1 week with the recording and the slides as well. And we hope you can join us for an upcoming webinar we have next month. For those of you who aren't familiar with Oldways, Oldways is a nonprofit nutrition education organization dedicated to improving public health by inspiring individuals and organizations to embrace the healthy and sustainable joys of the old ways of eating. We are best known for creating the Mediterranean Diet Pyramid, as well as the whole grain stamp. The Whole Grains Council is a program of Oldways. We help consumers find whole grains and understand their health benefits. We help manufacturers create more and better whole grain foods. And we help the media to write accurate and compelling stories about whole grains. And we're so excited to talk to you about whole grains and policy and child nutrition programs today. So before we dive in, I really want to clarify the language that we'll be using in this session. When the USDA mandates that a particular percentage of grains must be whole grain rich, it's important to understand what this term means. According to the USDA, 100% whole grain rich does not mean 100% whole grain. What whole grain rich means is that at least 50% of the grains are whole, and any remaining grain ingredients must be enriched. There's also some additional requirements in terms of serving size, and in the case of the Child and Adult Care Food Program, sugar in some instances. But in general, the point we're trying to emphasize is that 100% whole grain rich just means 50% or more whole grain. And this is in relation to the National School Lunch Program, the National School Breakfast Program, and the Child and Adult Care Food Program. And if you'd like to learn more about this, our speakers, of course, will have more to say on this topic, but you can also visit the USDA website. they are updating their whole grain resource right now, but they will be posting that online soon. And the Cacfp sponsors website also has some really great tools for that too. We're also going to talk a little bit about WIC today. So WIC, the Women, Infants, and Children program, is a little bit different. This program provides benefits for pregnant and postpartum women, as well as children up to 5 who may be at nutritional risk. Whole grains have been included in WIC food packages since 2009. While specific products that can be purchased with WIC vouchers are approved state by state, there are some federal rules that specify what types of whole grains can be included. So a particular, brand of bread or pasta or cereal, the specific product itself is going to vary from state to state, but in general, right now where the rules stand is that at least half of the cereals have to be whole grain. And then in the case of breads and pastas, those need to be whole grain. So WIC, a little bit different, like it varies from food to food and from state to state, but that's just a little bit of background to keep an eye on as well. And just to give you a bit of a refresher on the journey that we've been on regarding whole grains in school meals. In 2010, the Obama administration introduced the Healthy Hunger-Free Kids Act, which improved the nutritional quality of school meals. So under the new standards, schools were to gradually work their way up to making all of the grains served whole grain rich by 2014. In 2018, the administration attempted to roll back those requirements to 50% whole grain rich, but that was ultimately unsuccessful as that was overturned in the courts in 2020. So at that point in 2020, April of 2020, the standards reverted back to those put in place during the Obama administration. In other words, 100% whole grain rich, but of course that was overshadowed by a more pressing public health emergency, the COVID pandemic. So you can see where that leaves us today. USDA has announced transitional standards for the next two school years, which are looking at 80% whole grain rich. And then after the next 2 years, they are trying to come up with guidelines for school years following that, hopefully moving us closer and closer to the dietary guidelines. And really, I think that's the main effort behind that, is to be mindful of the challenges that schools are facing due to staffing shortages, supply chain issues, and things of that nature. So we understand that, lunchrooms today might look a little different than we anticipated, but we have our eye on the goal and are moving in the right direction. And then you can also see here some updates for Cacfp and WIC. So there's definitely interest in strengthening these standards, but we will see what the future holds. So now I am pleased to introduce today's two speakers. First up is Liz Guerin, who is a principal researcher at Mathematica, who specializes in evaluations of USDA's nutrition assistance programs. Her work over the past 15 years has focused on the school meal programs, and in particular, examining the nutritional quality of school meals in children's diets. And then after Liz, our second speaker will be Dr. Joanne Slavin, who is a professor of food science and nutrition at the University of Minnesota, an all-around kind of grain expert. So with this, I am going to turn it over.
All right. Thank you, Kelly. So hi, everyone. I'm excited to be here today to talk about the role that federal nutrition assistance programs can play in children's diets. I'm going to start by providing some context about how children's diets compare to recommendations for a healthy eating pattern. And then I'll talk about 4 federal nutrition assistance programs for children: the National School Lunch Program and School Breakfast Program, or the Nslp and Sbp, the Child and Adult Care Food Program, or Cacfp, and then the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. And for each of these programs, I'll describe the nutrition standards for the meals or the foods that are provided. And then I'll share some research on how each of these programs can positively influence children's diets, and specifically their intakes of whole grains. So throughout the presentation, a lot of the findings that I'll be talking about are scores for the Healthy Eating Index, or HEI. The HEI is a measure of nutritional quality that's used to assess how well a set of foods aligns with key recommendations of the Dietary Guidelines for Americans. And the HEI uses a scoring system to compute a total score, which has a maximum of 100 points. And the total HEI score provides an overall measure of nutritional quality. And this overall score is made up of scores for a number of components that reflect the different food groups and key recommendations of the dietary guidelines. For example, there are components for whole grains, fruits, vegetables, etc. And then each component has its own maximum possible score. So throughout the presentation, I'll be showing HEI scores that are expressed as a percentage of the maximum possible scores. And then the thing to remember with the HEI is that higher scores for the total score and each component, including the whole grains component, indicate higher nutritional quality and better alignment with the dietary guidelines. So this figure here is from the 2020-2025 Dietary Guidelines, and it shows total HEI scores across childhood and adolescence. And if diets were fully consistent with the Dietary Guidelines recommendations, we'd expect to see scores closer to 100%. But the diets of all groups of children ages 2 to 18 are falling considerably short of meeting recommendations, with total HEI scores ranging from 51 to 61. And then the same is true for children's consumption of whole grains. Their daily intakes of whole grains are well below recommended levels. This figure here shows an example for males ages 9 to 13 who have a daily recommended amount of whole grains of 3 to 4 ounce equivalents. But their average daily intake is just 1 ounce equivalent per day. And this trend of low whole grain intake is also observed for all age groups of children. So the USDA administers a number of nutrition assistance programs that specifically target children, and their overall goal is to increase food security and reduce hunger by giving children access to food and a healthy diet. So USDA's child nutrition programs help ensure that children receive nutritious meals that promote health and educational readiness. And I'm going to cover 3 child nutrition programs today: the National School Lunch Program, or NSLP, and the School Breakfast Program, SBP, which provide free or low-cost breakfasts and lunches to children during the school year. And the CACFP, which provides free or low-cost meals to children in child care centers, daycare homes, and after-school programs. And then the WIC program serves to safeguard the health of low-income children up to age 5 who are at a nutritional risk by providing nutritious foods to supplement their diets. And I should note that some of these programs serve other population groups as well, but today we're going to focus on children specifically. So first I'll talk about the NSLP and SBP, which are often referred to as the school meal programs. And for schools to receive federal reimbursement for the meals served to children through the NSLP and SBP, the breakfasts and lunches must meet nutrition standards. And the standards specify the types and amounts of foods to be included in the meals, and they also set standards for specific nutrients. The standards for school meals vary according to 3 different age and grade groups. So in 2012, schools started implementing new nutrition standards that had been updated to better align the meals with the 2010 Dietary Guidelines and improve their overall nutritional quality. The updated standards required more fruits, vegetables, and whole grains in the meals, and also limited levels of calories, sodium, and trans fat. So the nutrition standards set minimum amounts of foods to be offered in the meal each day and over the course of the week. And these are also referred to as meal pattern requirements. So for lunches, these include minimum amounts of milk, fruits, vegetables, grains, and meat alternates. Meat alternates are foods like cheese, yogurt, and nuts. And the standards also require minimum amounts of 5 vegetable subgroups to be offered in lunches across the week. Then there are also restrictions on the fat content and flavor of milk offered. And initially, the standard specified that all grains offered in meals had to be whole grain rich. And then there's limits on the amounts of juice and grain-based desserts that can be included. And then finally, there are average, minimum, and maximum calorie levels for the meals and limits on saturated fat, trans fat, and sodium content. I should note that the nutrition standards, as Kelly mentioned earlier, for schools have changed slightly since the initial updates took effect, specifically related to whole grains and milk. And over the past 2 years, during the pandemic, some of the requirements have been waived. So now I'll provide some findings on the role the school meal programs can play in children's diets. So USDA's School Nutrition and Meal Cost Study is the most recent comprehensive national study of the school meal programs. And the study collected data in the 2014-15 school year after the nutrition standards were updated. And in this school year, all grains offered in school meals had to be whole grain rich. The study examined a broad array of topics, including changes in the nutritional quality of school meals after the nutrition standards were updated. It also looked at the nutritional quality of children's diets based on whether or not they participated in the school meal programs. And the study also examined the extent of plate waste in school meals. So the study found that the nutritional quality of school meals increased significantly after the updates to the nutrition standards. For school breakfast, shown on the left here, the total score for the Healthy Eating Index, or HEI, increased from 50% of the maximum score before the updated standards were implemented to 71%. And then the score for school lunches, shown on the right, increased from 58% to 82% of the maximum score. So these findings show that school meals were more consistent with the dietary guidelines after the updated nutrition standards were implemented. And the slightly lower scores for breakfast are expected because school breakfasts aren't required to include specific food groups that are recommended in the dietary guidelines, like vegetables and meats. Whole grains in school meals also increased significantly. Oops, 1 second. Sorry, there we go. Increased significantly after the updated standards were implemented. And as a reminder, when data for the study were collected, all grains were required. Oops, let me go back, sorry. There we go, sorry about that. This is showing how whole grains in school meals increased after the updated standards. And all grains were required to be whole grain rich when the data for the study were collected. So HEI scores for whole grains in school breakfast increased from 38% to 96% of the maximum. And for school lunches, the scores for whole grains increased from 25 to 95%. So overall, these findings show that schools were providing nutritious meals to children and that the levels of whole grains in the meals were highly consistent with the dietary guidelines. But it's important to also look at whether children consume these meals and how that affected their diets. So these figures here show total HEI scores for meals consumed by children, with breakfast consumed on the lunch on the left and lunches consumed on the right. And the green bars show total HEI scores for children that participated in the school breakfast or school lunch program. And the blue bars show total HEI scores for children that did not participate in the program. So for both meals, the study found that children who participated in the school meal programs consumed healthier breakfasts and lunches. They received significantly higher total HEI scores than the children that did not participate in the program. And for both school breakfast and school lunch participants, their breakfasts and lunches consumed received significantly higher scores for whole grains as well, compared to children that did not participate in the program. For example, on the left, the breakfast consumed by school breakfast participants received a higher score for the whole grains component, 98%, compared to 68% for the breakfast consumed by non-participants. And it's important to note here that the HEI scores for whole grains for both the school breakfast participants and school lunch participants are really high at 98% and 100% of the maximum score. So this is indicating that participants' intakes of whole grains at breakfast and lunch were highly consistent with the amounts that are actually recommended in the dietary guidelines. So the study also looked at children's diets over 24 hours and found that school meal participants continued to have higher intakes of whole grains over the course of the day. Both school breakfast participants and school lunch participants received higher scores for the HEI whole grains component over 24 hours, and they were also more likely than non-participants to meet daily recommendations for whole grains. And finally, school lunch participants consume more than 50% of their daily intake of whole grains at lunch. So these findings show that the meals provided through the Nslp and Sbp were really important sources of whole grains in children's diets. And as I mentioned before, the study also examined levels of plate waste in school meals. So this figure shows the percentage of food groups wasted on students' school lunch trays. So for example, 30% of the vegetables on students' lunch trays were wasted. And as you can see on the right in the light blue colored bar, the percentage of whole grains wasted in students' lunches was low relative to most other food groups. So this is indicating that children who took whole grain items as part of their school lunch typically consumed them. All right, so next I'll move on to the Cacfp. So for childcare providers to receive federal reimbursement, the meals and snacks served to children must meet nutrition standards defined for the Cacfp, and Cacfp providers can be reimbursed for up to 2 meals and 1 snack per day or 2 snacks and 1 meal. And the Cacfp nutrition standards specify the types and amounts of foods that must be included each day in breakfast, lunches, suppers, and snacks. In 2017, Cacfp providers were required to follow new nutrition standards that had been updated to better align the meals and snacks with the dietary guidelines. And the updates required a greater variety of fruits and vegetables, more whole grains, and less added sugar and saturated fat. So the Cacfp uses meal patterns to specify the minimum amounts of foods that have to be included in the meals and snacks. And there are different meal pattern requirements for breakfasts, lunches, and suppers, and for snacks. And the minimum amounts required differ by age group. The table here shows meal pattern requirements for lunches and suppers for each Cacfp age group. So these meals are required to include milk, meat alternates, vegetables, fruits, and grains. Breakfasts are required to include milk, fruits or vegetables, and grains. And then snacks are required to include 2 of the 5 components listed here. The Cacfp nutrition standards also set restrictions on the types of foods that can be included in the meals and snacks. There's restrictions on the fat content and flavor of milk. For grains, at least 1 serving per day across all eating occasions must be whole grain rich. Fruit and vegetable juice can only be served once per day across all eating occasions. And for breakfast cereals and yogurts, there's a limit on the grams of sugar allowed. All right, so next I'll provide some findings on the role of the CACFP in children's diets. So USDA's study of nutrition and activity in childcare settings is the most recent comprehensive national study of the CACFP. The study included CACFP providers in early childcare programs, including childcare centers, Head Start programs, and family daycare homes, which typically serve infants through children age 5. The study also included CACFP providers of before and after school care, which typically serve older children. And the study collected data in program year 2016-2017, which was before the nutrition standards for the CACFP were updated. So for example, there was no whole grain requirement at that time. The study provides information on the nutritional quality of CACFP meals and snacks, as well as the quality of children's diets on days where they were in care and had access to CACFP meals and snacks versus days when the children were not in care. And I'm going to focus on the study's findings for 3 to 5-year-olds. So this figure here shows total HEI scores across each type of CACFP meal and snack served to 3 to 5-year-olds in early childcare programs. And the total HEI scores ranged from a low of 66% of the maximum score for afternoon snacks to 73% for CACFP lunches as well as suppers. And then across all types of meals and snacks served, the total score was 72%. So overall, across all eating occasions, the total HEI score was relatively high. And then this figure here shows the HEI scores for the whole grains component across each type of meal and snack. So scores for whole grains ranged from 52% of the maximum score for CACFP afternoon snacks to 68% for lunches. And then the score for whole grains for CACFP breakfast was 97%, indicating that the concentration of whole grains in these breakfasts was very close to what the Dietary Guidelines recommends. And then across all CACFP meals and snacks, the HEI score for whole grains was 71%. So even though there was not a specific whole grains requirement when data for the study were collected, CACFP childcare providers were including whole grain rich items in the meals, especially what we see here for breakfast. So this figure is comparing total HEI scores for children's diets on days when children were in childcare and had access to CACFP meals and snacks to their diets when they were not in care. And the study found that children's diets on childcare days received significantly higher total HEI scores, indicating that their diets were more consistent with Dietary Guidelines recommendations on days when they were consuming the CACFP meals and snacks than days when they were not. And then the study also found that 3 to 5-year-old children were more likely to consume whole grains on childcare days. On childcare days, children received significantly higher HEI scores for whole grains. They were also more likely to consume any whole grain item on childcare days compared to the non-childcare days. And finally, the study found that CACFP meals and snacks contributed 2/3 of children's daily intakes of whole grains. So these findings are showing that the meals and snacks provided to young children through the CACFP can be really important sources of whole grains in their diets. But despite the positive contributions of the CACFP meals and snacks to their diets, children's intakes of whole grains are still low relative to the Dietary Guidelines recommendations. All right, and then finally, I'll talk briefly about WIC and the role this program can play in young children's diets. So WIC provides a monthly food package that's designed to meet the special nutritional needs of low-income children up to age 5. And the WIC program has eligibility requirements based on household income and nutritional risk. And the food package includes specific types of foods that can be purchased, and the foods are intended to supplement children's diets. In 2009, revised food packages were implemented. the foods provided in the WIC package were updated to more closely align them with the dietary guidelines. And the changes increased the availability of fruits and vegetables. They added whole grain products, and they reduced milk, cheese, and juice allowances as well. And so the revised food package for children includes the foods listed here at the bottom of the slide. And as Kelly mentioned earlier, this includes breakfast cereals, in which half of the options in each state's list must be whole grain, as well as whole grain bread or other whole grain or whole wheat options. All right, so one recent study compared HEI scores for 2 to 4-year-olds for children who participated in WIC versus children who were income eligible for WIC but did not participate. And as shown on the left here, they found that WIC participants had significantly higher total HEI scores, indicating that their diets were more consistent with dietary guidelines recommendations than income eligible non-participants. However, as shown on the right, HEI scores for whole grains were similar for the two groups of children, and for both groups, the scores for whole grains were very low relative to the recommendations. And then a number of other studies have shown that the revised WIC food packages have had a positive effect on the nutritional quality of children's diets. One study found that the revised food package for children was associated with an additional 4 points for the total HEI score. And other studies found that children were more likely to consume whole grains after the revised WIC food packages were implemented. And this included a large increase in the HEI score for whole grains as well. So overall, research has shown that the federal nutrition assistance programs that I've talked about today make important contributions to children's diets, including their intakes of whole grains. And the nutrition standards for these programs are an important part of ensuring that children continue to have access to healthy foods. But there's definitely a long way to go in aligning children's diets with dietary guidelines recommendations. So thank you for listening in. And now I'm going to turn it over to Joanne.
Thank you, Liz. I appreciate it. So I have the privilege of talking about why whole grains matter in child nutrition programs and in WIC. So I just want to give you some disclosures, the boards I serve on, who has funded our research in most recent days. I also own a 1/3 share of our family farm in Wisconsin, and I talk a lot about plants. So here's some outline. We're going to talk about some of the recommendations. We're going to review the nutrition science and then look at some of the challenges of increasing whole grain consumption for children, and really to activate our audience to become advocates. And I know if you're on this program today, you already are one of our advocates, but we want to keep you on the team. So recommendations, we know we have to put together diets that optimize health. And nutrition guidance tells us what type of nutrients, so the dietary reference intakes, how much of vitamins and minerals. The dietary guidelines for Americans recommend food patterns associated with positive health outcomes and lowered disease risk. And I was lucky enough to be on the Dietary Guidelines 2010 committee to understand how important they are for improving the nutritional status of Americans. Then we go to the food guides that translate these recommendations into food servings that really do affect policies and can improve our diets. So I always like to use this slide. Janet King showed it long ago, but the science, the dietary reference intakes, and then all the way over to me, how does this long journey, and I think sometimes we say, why are we still talking about this? We already agree on that, whole grains are important. Why aren't we there? Because things move slowly. And, so we get the policy in, and then we have to continually make it work out in the real world. So appreciate the science is there. And then the dietary guidelines every 5 years are going to get updated. And then we are going to have this gets translated into programs. So this is just a summary. 1916. I bet none of you were alive then. I wasn't alive. Food for young children. We've always known the most important things are to get kids to have better diets. So absolutely, USDA has always been committed. And remember, food guidance is moderation and variety. We know there's no perfect food, and so putting foods together to make sure we get nutrients. over time, kind of the basic four, which a lot of us grew up with, this variety of foods. And then you look at 1992, the idea of grains being the base of the pyramid, that a lot of our calories come from that. And then now 2011, the Choose My Plate. And obviously, we tell people, if you put these foods together, that's going to bring along the nutrients you need and the dietary patterns we know that are associated with good health. So this is one of my students, Rebecca. We put together a perspective on carbohydrates and quality carbohydrates, trying to get people, generally our carbohydrate intake is not deficient, it's picking better carbohydrates within those categories. So grains are a place where we can do a lot of good because about half of our carbohydrate calories come from grains. So we want to increase the whole grain capacity of that and the quantity and decrease the added sugar. So what is USDA given with grain guidance over time? We've always known that grains are an important source of calories. 20% of calories back in 1916, and then the basic 7 and the basic 4, getting grains every single day. Then even in 1984, whole grain was mentioned, that it was important. There were no recommendations specifically, but the real turning point, 2005 Dietary Guidelines for Americans, giving a number. Let's try to make half of your grains whole, giving you let's kind of walk the walk here and say, we want to put a number and get people to eat whole grains. So this might be depressing, but it's actually tells you things move slowly, but they actually move pretty quickly. 2005 wasn't that long ago, but to get to that point, it didn't happen overnight. So going back to more whole grains, 1977, the Senate Select Committee, 1999, FDA health claim for whole grain foods. We mentioned the 2005 Dietary Guidelines, 3 servings of whole grains per day or half your servings at the lower end of servings. 2009, the final WIC food package requiring half of cereals approved by a state to be 51% whole grain and added other whole grain products beyond cereals. And then 2010, whole grain rich criteria for school meals, trying to find foods, give food manufacturers incentivize them to make more whole grain products. Whole grain rich, which Kelly explained to use in school lunch programs and school breakfast programs, also other programs. And then 2017, the National Academy recommending that all breakfast cereals meet whole grain rich criteria for WIC, which I think most of us could agree with. Why not do that? That's an opportunity for us. Definitions are not standardized, and this isn't too surprising. Every category, if it's a cereal, if it's a bread, if it's a pizza crust, coming up with one criteria or one standard is never going to be possible. So I think whole grain rich is a really good standard because it talks about the differences in food chemistry that we have to relate to. Dietary guidelines, half of our grains be whole, but generally they're still about 1 serving. And I've been talking about this for a long time, and I feel like we need to move forward and make the difference. There's no real concern about scientific support. And I also want, this is not against fiber. Whole grains are the biggest source of dietary fiber. That's also a nutrient of concern. So by increasing whole grains, we're going to also make some progress on fiber. This is something that we put together for, is there any debate on quality carbohydrates? And there really isn't. So whenever we try to say, what is the best quality carbohydrates we can have, whole grain composition is going to come in, whole grain content, and just recommending whole grain foods. So across the board, everybody who's come up with a quality carbohydrate index will say whole grains is number 1. It's really important to make that happen. This is just the diet disease relationship. Obviously, whole grains is associated with decreased risk of cardiovascular disease, and that's what a lot of our recommendations are based on. It's a very significant finding, but other diseases are equally connected to whole grain intake. So across the board, good recommendation. By increasing more whole grains, we're going to decrease chronic disease. I want to talk a little bit about our own research trying to work in the whole grain area. And this is one of my former students, Katie Kecker, doing a review of whole grain consumption on changes in the fecal microbiota. And what you find is that we get into the same problem with defining whole grains. So some of these intervention studies that said, hey, we gave a lot of whole grains and then we measured the fecal microbiota, actually, they weren't giving that many whole grains, and we couldn't even quantitate what they were giving them. But still, what we found is all of these different grains generally did affect the microbiota, similar to what we would expect with the increased fiber, but we did see differences that were inconsistent just because, and we find that a lot in these types of studies, but trying to say how much whole grain was given was difficult, which made it impossible to say this much whole grain is essential for changes in the microbiota. I also wanted to talk about, the number 3 is not really the magic number. That's the highest amount we have in the prospective cohort studies we have. So the recommendation, 3 servings of whole grain for sure, but we see even better improvements in mortality risk with higher intakes of whole grains. So we absolutely need to get people to 3. If we could get them higher, we would all be better off. A little other way of looking at this, and I really appreciated Liz's overview of, what are the effects of giving recommendations for whole grain and getting people to make these changes. So absolutely, we want to encourage it. We want to see that, but also there's an economic, we can model the economic benefit of higher whole grain intake. So this is some really interesting studies. One of our former students, Mary Murphy, one of the authors here. And what you do is you look at healthcare costs. What could we save by taking more whole grains in the diet and replacing the refined grains with whole grains? And what they found in these studies, increasing whole grain intake by 1 serving per day across American adults could save significant medical costs. $22 billion annually from reduced risk of cardiovascular disease, and another $14 billion in coronary heart disease reduction. So trying to get people to buy into nutrition, you guys know, you're dietitians, you've been out there trying to say, hey, let's make some changes in dietary patterns and get people to do things. This really shows that there's going to be benefits if we can get people across age groups, starting when they're young, to increase whole grain consumption. I want to talk a little bit about the dietary guidelines, just because I think a lot of people think, well, right now it's just open today. You can actually go in and give your comments to the Dietary Guidelines Advisory Committee. Nice thing about the dietary guidelines, it puts together government agencies that sometimes are criticized for not working together. So USDA, Health and Human Services. It's about a 2-year process to get to the dietary guidelines and update the science and publish the dietary guidelines. So it's an amazing process. Other countries are in awe that we have it. So it is a amazing process that helps us trying to improve diets. So 2020-25 dietary guidelines for Americans, they added the B to 24. So birth to age 2 was added into the dietary guidelines, which took up a lot of their effort and is really important that we know if we can start early, those dietary interventions are going to have a payoff down the line. So the evidence-based, research-based nutrition communication tools, and it really does inform all of policy. So when people are like, I don't even know what they are, who cares? We all need to care. They're incredibly important. So this just gives you some idea. I used to think this myself, that who really cares, but it is a big deal. So for policy, what we're talking about today, that once we have things within the dietary guidelines, we know that these health outcomes are affected by dietary interventions. We want to make sure that our government programs support that. So what Liz told you about really shows that if we can put some teeth into this and say, hey, we need to make sure whole grains are part of these programs, it really can make a difference. Just getting people to make whole grain products that taste good. So formulation, there's been a ton of new science on that, definitely works, and just educating. Where are whole grains and how do we get people to understand and purchase them? So here's just the dietary guidelines, this idea of a framework for guidelines, make every bite count. At every life stage, follow these healthy dietary patterns. And the healthy eating index that Liz told you about, scoring your diet based on the recommendations of the dietary guidelines. The idea that we want to make sure people like the food. So personal choices, cultural traditions, budgetary considerations, those are all huge impacts. We need to be conscious of that. Food group needs that are nutrient dense. So this idea of getting rid of added sugar, getting rid of solid fat, and then same thing over in 4, focusing on these whole foods that we know have the nutrients we want to deliver. So some of the highlights, we said, we're going down to ages birth to 24 months. And added sugar and saturated fat, it didn't change. So both less than 10% of our total calories. Alcohol didn't change, moderation. And then this idea of making sure that we think about personal preferences, cultural foodways, budget. And that's always been in the dietary guidelines, but making sure that those things are provided for, and we're considering that, and not to have them so structured that they don't work for certain groups. Oh, you've already heard about this. Most Americans don't meet the dietary guidelines, and it's across all life. Just as Liz showed you for kids, same problem, that we're just not making a lot of progress. So recommendation, at least half of total grains should be whole grains. Hasn't changed, still there. And enriched grains. This is what always kind of gets us into this good foods versus bad foods, that enriched grains are not bad foods. And the whole grain rich category says we want whole grains, but we also want those enriched grains along with it. And looking at intakes of all Americans, you already saw how far we're falling short for children, but 98% of Americans fall below recommendations for whole grains, and 74% exceed limits for refined grains. So we don't want you to eat more grains. People eat more than enough grains. It's just we need you to swap it out. And we need to push more whole grains and say, hey, we're going to take some refined grains out of the diet to get to those whole grain recommendations. All right, this is what we just talked about. We are falling way short on, whole grains are too low, refined grains are too high. So for the average person, increasing those whole grain servings any way we can do. And everybody needs to be on the team, whether you're a food manufacturer, dietitian, all of us, consumers, parents. Refined grains exceed limits, whole grain intakes far below recommended levels across all groups that we look at. So, interesting data, 2019, worldwide diets low in whole grains were identified as the second leading dietary risk factor attributed to disability adjusted life years. Whole grains daily can reduce risk of disease over a lifetime. This is what's very exciting. If we can get you early on to accept whole grains, and there's some really good tasty ones out there to make those switches. When we model this, we know there will be benefits throughout the life cycle. So number of exposures is pretty interesting. If you've taught life cycle nutrition or have kids, you know this. Children aren't as picky as adults expect them to be. There's lots of whole grain products right now that children would accept quite easily if they were exposed to them. And this is the time where you can actually teach healthy eating habits and to help children understand that whole grains taste really good. And some of the newer products that are out there across all different categories, breakfast cereals, breads, snacks. There has been many pizza crusts, things that we wouldn't think of that are now whole grain rich compounds, foods that are out there that kids will accept. And if we don't put a negative in us, that's so often whole grain is like, oh, they don't taste good. They actually taste really good. So top sources, where do kids and adults actually get whole grains? Breads, rolls for both groups, ready to eat cereal. If you look at adult snacks, cooked cereal, sandwiches, children sandwiches, snacks, pizza. So it's nice, like the WIC program and other programs that give you choices throughout categories, but you can see the importance of ready to eat cereals as a top source of whole grains and a real opportunity to increase whole grains. My plate, obviously, is this idea of swapping it out. So grains, half your grains are whole, and that you can find whole grains. It's so nice to work with Whole Grains Council because they're helping consumers people find whole grains. Is this a whole grain product? Because it is a bit confusing. It's not always dark brown and disgusting. That's not how we find it. We can find it in other ways. So getting people to make those switches. So eating pattern is more than the sum of the parts. So all of these parts come together to bring nutrients into the diet. And all of these programs have to be concerned about that. We want to get the nutrients in the diet and the eating patterns that are going to help us minimize our risk of developing diseases and for our health along the way. So within that grain category, moving towards whole grains rather than just saying eat more grains. That's not the message we need. So opportunities, I think these are the, what is the ask? The ask is WIC adopt the recommendation that all breakfast cereals be whole grain rich. I think that's a really minimum thing to do. There's lots of very tasty cereals that kids like in that category. So, and it's clear, right? Whole grains were committed to it. So let's make the move. Let's just require it. The way it is right now is it's just a little too loose in my mind. Same thing for school meals. And obviously COVID and some of these things have affected this, but if we take our foot off the pedal right now, I think we're going to just have people say we're going to give up, and we don't want to do that. Move towards all grains served in the school meal program as whole grain rich. Again, if we are committed to this, we have to really show our commitment. And the same thing, all of these programs have different organizations and different people, but the message is consistent. And I appreciate Liz talking about how difficult it is to have these standards and push through. So in conclusions, and this is carbohydrate quality, including a focus on whole grains, is accepted in dietary guidance. There's nothing, it's one of the things that we can all agree on. Eat more whole grains, eat less refined grains. Universally supported, and substituting whole grains, not eating more whole grains, but taking some of the refines out of the diet and increase substituting whole grains is what we're looking for. And some of the really interesting ways of kind of motivating people to say, hey, we have to work harder on whole grains, because we have some modeling data that shows if we can increase whole grain consumption up to the levels that are recommended, we can save cost. And obviously economics, a lot of times politicians are a little more interested in that than some of our diets things. Cost, sustainability, supply, culture, convenience, all impact whole grain intake and must be considered in dietary guidance. And we always sometimes lose sight of that, but a lot of these things, moving them forward, we have to be attentive to that. And we must support and strengthen the child nutrition programs to enable higher whole grain intakes in kids. The science is there. We need to be committed to it and make it happen. So I appreciate your attention, and I'm going to now hand it over to Kelly.
Thank you all. Thank you to both of our speakers. This has been such a great update. I just want to close and remind everyone before we take questions, I think both of our experts today really emphasized that whole grains are a really effective and important way to improve public health and diet quality through each of these programs, particularly in the child audience. Whole grain consumption through government feeding programs can positively impact dietary quality, and especially at these young ages, just set the stage for healthy habits down the road. Someone asked a question about acceptance, and I'm glad that came up because, as Joanne mentioned, whole grain exposure does help drive acceptance in children, and it's really about those repeated exposures over time, so that they can get familiar with the food and grow to love it. Joanne also mentioned some updates about ways that we can have our voice heard. So for the National School Lunch and School Breakfast Program, the comment period has closed regarding the transitional standards for the next 2 school years, but the USDA is actively working right now to draft the school nutrition standards for the following years to move them closer to the dietary guidelines recommendations. So definitely keep an eye out for that because we want to continue to advocate for whole grains and make sure that those are a part of the equation and get us back to that 100% whole grain rich, where we want to aim. For WIC, there seems to be a little bit of movement and a little bit of interest in taking another look at those recommendations, particularly regarding whole grains, cereals specifically, but kind of looking at the food packages overall. So that's something to keep an eye on. And then thank you to Joanne and for the commenter also who mentioned the dietary guidelines process. The email went out today, so they're allowing comments to open starting tomorrow about the questions that they're going to study in upcoming iterations of the guidelines. So this is a really great time to be involved and continue to advocate for whole grains. We have a little bit of time for questions, so you can go ahead and type those into the chat box or into the Q&A box. And while you type those in, I'm just going to take care of some of those housekeeping questions that came in. So yes, this session is recorded, and we will be sending an email to all of you with the slides and the recording and the CPEU credit for registered dietitians within 1 week. We are not providers for other types of professionals, but for registered dietitians and DTRs, you'll get that certificate. And so with that, I think we will dive into some of these questions. Starting with Liz, they're looking back at some of your earlier slides that you presented regarding the National School Lunch and Breakfast Program and the Healthy Eating Index. Does the difference in HEI scores for participants versus non-participants look at what was served, or does it also look at plate waste? Can you clarify?
Yeah, sure. That's a great question. I didn't have time to get into the methods on that study, but we used 24-hour dietary recall data to look at HEI scores between participants and non-participants. So the estimates are based on what the children actually ate. And all of the dietary recalls collected reflected kids' intake on a school day. There were no kind of weekend days in there.
Thank you. Our next question for Joanne. For the studies that are showing a decrease in disease risk associated with one more daily serving of whole grain, what is the whole grain replacing in those diets? Is it one more whole grain serving in place of refined grains, or can you clarify?
Yeah, that's an excellent question. And I think that these types of studies, we really don't know that. Like we could look at what the total, do fruits and vegetables go down, or does anything else go down or go up in these studies? So we would never be sure. I don't think we can give you that data just because of the type of study it is. And it is, it's a really important point, is that a lot of this is modeling data. So, we have to model it rather than, it's not an intervention study. So often too, the intervention studies don't show as much as people expect. And that is true, like in the fiber world too. Like if we increase fiber 3 times and we want to lower cholesterol, sometimes we don't see that. So I think that the data, that's the strongest data we have for cardiovascular disease protection, is really strong for whole grains. So to me, that's the strongest support we have.
Thank you. And Joanne, another question that's come in a few times, the new dietary guidelines, you mentioned that they included recommendations for under 2-year-olds. Did they address whole grains in those recommendations?
Yeah, that's a good question, because I would say no, not specifically, because, like for kids, having taught life cycle nutrition, when do grains come in? A lot of the grains that we would recommend for a toddler as a food replacement would be to get iron into the diet. So it would be like a rice cereal rather than whole grains. So I would say the recommendations, half of your servings whole grain would still be consistent, but I don't recall that, there really wasn't any data, but there would be no reason to think that, because I think the allergy issue always comes up. It's like, would there be more allergies with whole grains versus refined grains? And we don't really have that data. The idea of gluten is a specific allergy that I think is relevant here, obviously, that we need to be considering. But for kids, probably below the age of 2, the number of servings of grains they're going to have is pretty small, and there would be no reason for them not to, besides allergy concerns and introduction of foods, in the normal way we talk about it, just to make sure we don't have an allergy, then there would be any reason to avoid whole grains with them.
Yeah, I think that's a great point, is that remembering that these young eaters under 2 really need so little food a day compared to adults. But if You go to the Dietary Guidelines website, you can download the whole document, and there are tables for different age groups, including the 12 to 24 month age group that has tables for grain recommendations. Again, the amounts are much smaller than what you would see in adult. It's not the 3 to 6 servings that we see. But interestingly, some of those proportions are more than half whole grain for kids under 2, just because in order to get all the nutrients they need for a growing body without going over their calorie needs, whole grains are well fit for that. So yeah, dietary guidelines as well for more details. I wanted to address one of the questions that came in about corn. We had a lot of people asking about corn and reading labels. And so if the ingredient list doesn't specify, like if it just says corn, it is not possible to know if it is whole grain or refined, unfortunately. And that is a big source of confusion. And that was definitely part of the motivation of our work at the Whole Grains Council in creating the whole grain stamp and evaluating those products individually, working with the manufacturers to be like, hey, when you say corn, what do you mean? Like, can you clarify, was any of it sifted out? So yeah, I wish I had an easier answer, but there's really not a way to look by looking at the ingredient list alone. Gosh, there's so many great questions in here, but we'll send you the slides and the recording. I'm afraid we've hit our time for today, but thank you all for joining us, and huge thank you to our 2 speakers and to the Bell Institute for Health and Nutrition. Thanks for joining us, and we hope to see you again.